When I started at the Allen Pavilion, there was no family medicine program. I remember the vacuum, the need for having physicians who were broadly focused caring for patients. There was a great interest on the part of the hospital in attracting those folks here and in training good quality primary care physicians.
Family medicine at NY-Presbyterian Hospital's Columbia campus began 9 years ago with one physician. Today we're a team of almost 20 attending physicians, residents, fellows, nurses, and staff working to provide the highest quality care in over 28,000 annual patient visits. We work in settings as diverse as the communities we serve. We've earned a national reputation for our residency program and have become a popular site for medical students. And we continue to develop our research program in order to address the needs of the patients in the communities we serve and to enhance our teaching.
We're a specialty of breadth, and we try and take as large a view as we can of the context of the illness in the patient's life.
We're there for them from birth, when we're having to give their vaccinations. We don't let them go when it's time to go to college. We get them all prepped for that. We're there with them when they're managing their diabetes, and then again when they're passing.
Ya yo tengo como casi 2 años visitando la clínica. A mí me ha ayudado mucho tener la misma doctora antes del embarazo y después del embarazo.
I feel like it was a very smooth and seamless entry into the prenatal care because I obviously knew a lot about her history beforehand. We provide a lot of the services that women might need and might usually go outside for. Not only is it convenience for the patient, but they're much more likely to be on time in getting their PAPs and their mammos because they're here anyway.
This is a picture of my mom. This is Ada Santos. My mom was someone who was very loving. She loved all the doctors here, and she understood how much effort was put into keeping her alive.
I had the task of trying to help this family cope with the new diagnosis of HIV in their mother. Over time, she became more ill to the point where she actually needed a liver transplant. So my role was to try to integrate all the things that all the specialists were telling this family, and if there was a situation where they felt they didn't understand, usually it was my role to then go and work with the specialists and help them understand what the family's concerns were, and also translate for the family what the physicians were trying to say in a manner that they would understand.
Family medicine constitutes an area of uniqueness for us here at Allen Pavilion. We are the home of the family medicine program on the inpatient side.
Our residents are integrated into all the different services here. At least for our NAGL patients, there is a strong element of continuity because the residents that take care of them are required to come here and see them in the hospital and follow them in the hospital.
One of the most frequent calls that I get as a surgeon is, I take care of a patient, I get them better over their acute problem, and they say, I appreciated my care here. I want to be connected with a doctor who's going to follow me long term. Do you know of anyone good that would do that? I send a number of patients to see our family physicians.
Well, this afternoon we're going to go and see Isabella Polsky, who is my 92-year-old patient. Mrs. Polsky was normally coming to the clinic, but when it got to the point where I could see it was physically difficult for her, I offered to go to her home. Doing home visits is a service and a teaching opportunity that we do in the program.
Our priorities as a department, I think, coincide with the priorities of the medical center, which is first of all to deliver excellent patient care at the highest level, and then as a teaching institution to make sure that our residents get the best possible training.
The medical students come with all kinds of backgrounds and all kinds of desires for their future. They're not necessarily interested in family medicine.
Well, I want to go into anesthesiology, and I'm applying for that now. I see more, and I spend more time with patients here than I have on any of my other rotations. This was the only place that I came during medical school that people really wanted to teach students about primary care.
Over the 5 years that I've been here, the quality of our residents has risen dramatically. I mean, we are really, like, at this point, attracting the top medical students in the country who are interested in going into family medicine.
I think they're attracting a superb cadre of young people who are committed. They really care about all aspects of care of the patient, and they work very well with the specialists.
In the context of evaluating our efficiency as an organization and looking at how the different channels of patient care are delivered, we found that the family medicine residents compared very favorably, in fact, in terms of length of stay and efficiency to the other methods of delivery.
Any academic department has to have what we call the three-legged stool, and that includes clinical service, a good teaching program, and a research component. I think that our research is the part of our program that we really need to work on and build at this point. We've done a lot of work with our residency program and with our clinical work, but the research and what I call the research and development arm of family medicine really needs to be developed and supported. One area of research that's appropriate for family medicine is community-based research.
Did you know? Did you know? Did you know? African American and Hispanic women together comprise less than 25% of all women in the U.S. And they account for 78% of AIDS cases in U.S. women. So we make up less than 25% of the population of women, but account for 78% of the AIDS cases. Talk! Girl Talk.
Girl Talk is a program that was developed by one of our residents. It's a doctor-student education process that takes place in the high school. The children make a video about their experience. We do pre and post testing to show the effectiveness, and it's been a very, very successful project and program that I think demonstrates a little bit about what we represent and what we're trying to do in family medicine research.
Over the last 9 years, family medicine at New-Presbyterian Hospital's Columbia campus has undergone remarkable growth, but there's still untapped potential. According to Merritt, Hawkins & Associates, in 2004, family physicians generated over $2 million in hospital revenues, on par with internists and second only to surgical subspecialties in cardiology.
I think that family medicine plays a crucial role in primary care in the United States. There are more visits in the United States to family medicine doctors than any other specialty. Any kind of strategy for delivering primary care to the U.S. population as a whole has really got to include, I think, family medicine in that model.
Even today, it is still difficult to find enough good family physicians, generalists, for the patients who need them and who request them. We are a huge training institution, and I think we ought to be right in the middle of trying to train and produce that cadre of well-trained family physicians.
Our family medicine program, I think, constitutes a competitive advantage for our institution. But I also think it's one that we're not realizing to the full extent possible. To some degree, the program has been constrained by not having a broader reach in our community. We've certainly seen competitors reaching out to Westchester, New Jersey, and Queens. It seems to me that family medicine is a very unique channel to our center, which would provide the opportunity to capture more patients, strengthening the family medicine program through additional resources, whether they be space, whether they be new practice sites, whether they be support for faculty, in my mind, makes sense. In fact, to do otherwise will hamper our efforts in this hyper-competitive environment.